My name's Sarah Brewer, and you will also be hearing from my colleagues Nick Axford and Vashti Berry, and we are all researchers at the Social Research Unit. This webinar is the second in a series of 6 webinars that we're running over the next few months. The slide that hopefully you can see in front of you now is just a quick reminder of the topics of those 6 webinars. So we've already done the first one, which was on developing intervention manuals, which I'm really pleased to say many of you joined us for. The recording for that is still available for you to view on our website if you did miss it. And hopefully it will come as no surprise to you, since you've registered, that today's webinar is on serving the right people. So just to give you a quick sense of what we hope to cover in the webinar and what the structure of the hour will be, it's divided into 2 parts, 2 inputs that we're calling the what and the how. And each part will be followed by a 15-minute discussion where we'll field the questions that you're sending to us throughout the course of the input. And there'll be Nick, myself and Vashti all there to try and answer those for you. So the first part of the webinar, the first input, will be me talking through the kind of what, and then Nick will take you through the second part of the webinar, and all 3 of us will be involved in the discussion. So I think we're ready to get started. So this webinar is about serving the right people, and it sounds like a really straightforward exercise. You know who your intervention is for, and you know who the intended beneficiaries are, but the distance between an intervention and its intended beneficiaries can actually be quite long. The journey involved to get a child or family connected to an intervention is not so much a walk next door as 2 people taking different routes across a city using multiple modes of transport, just so that both end up in the right place at the right time. And it's really easy to underestimate the challenge of serving the right people. So when you come to working out how to do that for your intervention, you need to really give it some time and some careful thought. And as you can see on the slide in front of you, we think that there are potentially several groups of stakeholders that you might need to engage. So first of all, parents might need to be engaged, either because the intervention is for them, or it's for the whole family, or because they need to consent to their child participating. And then if you look at the slide, you'll see that grey diamond saying referrers. So sometimes referring agencies need to also be engaged, because they might know the right families when you don't, and you need them to refer children or families to your intervention. And then if you look in the pink circle, which represents the intervention, you'll see practitioners. So the people delivering your intervention also need to be engaged, otherwise they're not going to be as active as they should be in trying to find the right children and families for the intervention. And then finally, the big grey arrow. So the organisation providing the intervention or commissioning it also needs to be engaged, otherwise the intervention won't exist or be delivered in the first place. So even if you are replicating an intervention and have already thought about how you reach the target group, it's always good to think afresh about whether there are new or different referral pathways given the new context in which you are replicating. And the challenge might seem greater in the case of targeted interventions, where you are aiming for children with a specific level or type of need. But even in universal interventions, for example, one delivered to a whole school, you will have to get the school to sign up, the teachers to deliver the intervention, and sometimes parents to consent. So hopefully if you've attended our regional events, some of this content in this input will be really familiar to you and will hopefully cement the learning, but it also provides an important context for the nitty-gritty of the part 2, the how-to section of the webinar. So as I go through all of this content, try to keep in mind your intervention and your replication plan. So an important first step to getting the intervention to the right people is to know who the intervention is for. And there aren't any silver bullets to shoot down all childhood problems, and research shows that whether universal or targeted, effective interventions are selective about who is being helped with what. So even universal interventions can be selective. Most often, they might be selective about children's age and their stage of development. So the intervention might target children in the preschool years, for example. So that would be from birth to 4 or 5 years. Or it might be targeted for children in the primary school years or secondary school years or even in young adulthood. Universal interventions might reach all of the children in one of these age brackets. Or perhaps the intervention is designed to reach a selected group, say those at risk of developing mental health problems or those displaying particular risk factors. This would be a targeted approach. So you can see on the slide there that all of the children in the particular age bracket were represented in grey, but some of them are eligible for your intervention because they display particular characteristics, and those are the ones that are shaded pink. So for those of you designing a target group or thinking about your target group, a key question to ask is, does the intervention seek to prevent problems from occurring, or does it get in there early at the appearance of the first signs of a problem, or does it treat problems once they have been diagnosed? So just to unpack that a little bit, one example of an intervention that seeks to prevent problems from occurring would be the PATHS programme. So that programme, along with other similar social emotional learning programmes, focus on children in the primary school years and on preventing the onset of emotional and behavioural difficulties, as well as the linked problem of falling behind at school. By contrast, the Incredible Years parenting intervention is all about early intervention. It's about helping the parents of children who are at high risk of developing a conduct disorder in the preschool years. And just note here that in this instance, when we say early, we mean early in the stage of the development of the problem, and not, in this case, in early in the child's life. And that's an important distinction to make. And then finally, there's programs like functional family therapy, which are designed to treat young people with diagnosed conduct disorders. And those are the kids who are generally perceived to be a bit of a headache for social care, youth justice, and mental health agencies. So as well as thinking about who is eligible for and might benefit from your intervention, it's really important to also consider if there are any reasons why certain children or families might not actually be appropriate for the intervention, for example, because of their age or the nature of their difficulties. So you can see here on the slide that these two pink kids, the girl and the boy there, whilst they meet the inclusion criteria for the service, there is some other aspect of their development or circumstance that means that they aren't right for that particular intervention. Being clear about the focus of the intervention, as well as the inclusion and exclusion criteria that determines whether a child or a family is eligible for the service, will increase the chances of achieving the desired outcomes for those families. So after going to the trouble of focusing the target group, it's then really important to make sure that the right children end up getting the intervention. And even the most effective intervention for improving, for example, the behaviour of preschool children won't have much impact if it's delivered to kids in secondary schools. Likewise, an intervention that's designed for children with a personality disorder is likely to be of limited value if it's offered to children with minor emotional problems. So as we've kind of tried to capture on the slide, you can see these kinds of situations are rather like slotting a square peg into a round hole. So to achieve the desired effects of the intervention, you want to make sure that children or families who most stand to benefit are the ones that get the service. You want to get round pegs in round holes. If the wrong children or families get the intervention, they might actually be harmed, and at best they are unlikely to benefit much. They will be taking the place of someone who could benefit more, and this is a real waste of resources. In part 2 of the webinar, Nick will be giving you some ideas about how to make a plan to reach the right children and families. And there are 4 really important concepts that are central to this planning process. 2 of those concepts are need and demand. So when we refer to need, we are talking about how many people in a given population fit your target group criteria, whereas demand refers to the number of people who actually want to use your intervention. You want to find the people who are in both groups, people who both need and want your intervention. And there's a big difference between needing something and needing and wanting it. So the slide on your screen will help to illustrate those differences. So say, for example, you have an intervention that is for 11 to 16-year-olds displaying antisocial behaviour at home and school, and you want to know how many of the young people in the population meet this criteria. So on the slide on your screen, you can see that the population as a whole is represented in this big circle and the dark grey shading. So this could be all the children in your community, your town, city, county or country, whatever your population is. And the proportion of children in the population that do meet the criteria for your intervention, they are displaying antisocial behaviour at home and at school, and who therefore need the intervention, are shaded in that red wedge there. So that piece of the pie could be bigger or smaller depending on the intervention that you're replicating, but it represents the number of people in the population who need the intervention. You'll also see a smaller overlapping green circle. Now, in that circle are the young people or the families who want the intervention. So they would be the ones that are likely to take up the offer of the service and engage with it. This circle represents the demand for your intervention, and that will also vary in size depending on your intervention. And you can see that there are some children and families who want the intervention but who don't need it. Those are the ones in the top right kind of half of the circle. We might describe those people as the worried well, but there are also some other people in the bottom half of that circle who overlap with the red wedge. So these are people who, as well as being eligible for the service, are those who actually will take it up and engage with it. Those are the guys that you want to reach. Serving the right people means identifying, recruiting and engaging those people who both need and want the intervention. So gathering good estimates about need and demand, so the proportions of people in the circle and the wedge, has a number of advantages. It can help with planning the distribution of resources and time, and it can also feed into plans for recruiting and engaging children and families. A good example of this comes from the experiences of a team implementing a parenting programme in children's centres. So research shows that it's really common for service providers to overestimate demand for their service. And in this instance, children's centres were really confident that they were going to recruit the many parents and that recruitment wasn't going to be a problem. But over time, it became apparent that they weren't recruiting anywhere near the number of parents they needed to run the parenting group successfully. And their natural response was to think about lowering the threshold and accepting other parents with fewer difficulties to make up the numbers. But the team had already collected some very robust local data about children living in the area, and they knew that the level of need was actually there. Because that information on need was available, the project managers were able to be hardline about not lowering the threshold for the intervention and to encourage children's centres to be more proactive about finding families that were right for the intervention. It's also worth taking a few moments at this point to think about push and pull. So very often we are pushing interventions onto children and families. They tend not to put themselves forward for interventions voluntarily or knock on the door and ask for help. And in many ways, our aim should be to try and switch this around so that we create more pull for the intervention by increasing the level of demand for it in the community. And in the second input of the webinar, Nick's going to give you some ideas about how you might go about doing that. So we've talked a little bit about the importance of understanding need and demand, particularly for the purposes of recruiting and retaining people in the intervention. But what exactly do we mean when we talk about recruitment and retention? And these are the last two concepts that are core to thinking about how to plan for reaching the right people. So when we talk about recruitment, what we're talking about is getting people to sign up to and attend a programme or intervention. Retention, on the other hand, refers to getting people to keep attending, to keep coming to sessions. In our experience, difficulty with recruiting people to interventions is common. So one of the reasons for this is that service managers and practitioners have a tendency to overestimate the level of demand for their service, as well as the ease with which they can engage or recruit the children and young people or families that they're interested in. And the illustration we gave earlier about the parenting groups and children's centres is a really good example of that. But it's really important to make sure that enough children and young people or families are recruited and that you don't end up with a lot of empty spaces. The problem with empty spaces is that vital resources are wasted and that children and families who are in need of the service miss out. And it's also worth bearing in mind that some group-based interventions actually require a minimum number of people in order for the intervention to work well and to be cost-effective. So difficulty in achieving the required numbers may actually tempt practitioners to relax target group criteria. So they might allow children or young people or families whose needs are less severe to participate in an intervention that has been designed for those with much higher levels of need. That might help increase the numbers that you've recruited, but actually it will dilute the impact and the effectiveness of the intervention. Of course, successful recruitment is nothing without good levels of retention, which can be equally as challenging to get right. It's obviously good if children, young people and families attend the first session of a programme, but they need to keep attending if they are to feel the full benefits. And a common assumption that we make is that once people come to one session, they'll keep on coming. And we know from research that in many cases, life gets in the way and this doesn't happen. So for this reason, practitioners need to think carefully about and work hard to keep service users engaged. And one way you can do that is to provide what we would call wraparound support. And we'll talk a little bit about that later on in the how-to input of the webinar. And then there's also a kind of moral dimension to all of this too. So the UN Convention on the Rights of the Child states that children with particular needs, including needs that place them at risk of pathways into offending, which is the focus of realising ambition, have a right to be helped. It cannot be good for vulnerable children and families to lose out because insufficient effort has been made to make available services accessible to them. So to kind of summarise the main messages from this input, there are likely to be multiple different stakeholders that you might need to engage in order to reach the children or families you want to serve. Understanding need and demand is really important for a number of reasons, and thinking about effective recruitment and retention should also be central to any plan for reaching the right kids. So before we think about some of the ways that you can make those plans, we have a little bit of time now, I think, for questions on the content so far. So I will hand over to Vashti, who's been valiantly manning the questions box.
Hi everyone. Well, I've just sent you all a message to say if you've got any questions so far based on the content that Sarah's delivered, then send them through to me. We've had a couple of questions, but there's certainly space for some more in the discussion time. So feel free to email some things through. So Sarah, Nick, or I guess myself, one of the questions that's come through is picking up on this idea of children who aren't appropriate for services, and how people would go about establishing that. So Nick, do you want to take this one? How would you go about establishing children who aren't appropriate for your intervention?
Thanks. Well, I guess I would suggest definitely going back to your logic model for starters. You want to be clear that the things that you're doing in your intervention are likely to have a positive impact on those children. In other words, that you're addressing key important risk factors and protective factors. I think you would want to look at some research as well, and a good example. So a good example would be we know what works for reducing persistent offending amongst young people. And we know that that requires a pretty intensive intervention and something that is more light touch wouldn't have the same degree of effect. So I think one thing you want to look at is, are there young people for whom this intervention wouldn't work, might even make things worse. The other example I'd give, which I think we gave at the regional training, was of children who they display all the risk factors and the problem, but the risk factor that is causing their particular difficulty or problem isn't addressed by the intervention. In other words, the intervention won't have any effect. So definitely do some research, look at what other people have done and found effective.
Great, thanks, Nick. Looking at some other questions that have come through. And actually, this is something that I think was raised at one of the regional events. So the person says that they've got a target group, or it's a targeted intervention, but the young people that they serve tend to have a lot of different risk factors. And so if they were trying to refine that target group or be more specific, how would they do this? How would they refine that? Sarah, do you want to take that one?
So I think that's probably a similar response to the last question, and it really will depend on your logic model. So we would really encourage you to go back, look at your logic model, think about your theory of change. What are the specific risk factors that your intervention kind of combats or has an influence over, and think about prioritizing those when you're selecting kind of a risk profile for your target group. Yeah, I think that's probably the most straightforward way to do
it. There's been a request from someone just to, I think, kind of go back to the start of the webinar and repeat the key questions that were that you thought should be addressed in terms of the intervention. So the first question was, does the intervention seek to prevent those problems occurring? Those three different approaches, can we just repeat those and kind of pull them apart and be sure that people are clear on them?
Sure. So that question was about whether your intervention seeks to prevent problems from occurring in the first place. So the example for that was a PASS program where it acts for, it's a universal program that helps all children develop particular skills that are known to prevent the occurrence of emotional and behavioural problems for many children. So the idea with that is to think about preventing something before it occurs. The second kind of linked to that was whether you're getting in early at the appearance of the first signs of a problem. So this might be you've got a target group where they're at high risk because of some particular characteristics or aspects of their lives for developing a specific problem. So you might think, if you were at the regional events, back to the chain that we showed on the wall, so if you've got a child living in overcrowded conditions with a parent who's stressed and struggling and is parenting inconsistently, they are at high risk of developing behaviour problems. So you might think about, and they may well actually have already shown some signs of behaviour problems at a low level. That's where your early intervention is getting at. That's what your early intervention is getting at. And then the other kind of dimension is whether you are treating problems once they've already been developed and become entrenched. So for kids who are living in those conditions, perhaps have been living in those conditions for 5 years and they've now developed serious behaviour problems, they've been diagnosed with a conduct disorder, some interventions will target those kids specifically, like functional family therapy, which is a treatment approach, a family therapy approach for kids who have already got entrenched difficulties. I don't know if Ashley or Nick want to add anything to that. That's okay.
Great, thanks. Hopefully that's answered that person's question. Another question that's come up is whether there is any value in looking or monitoring the people who drop out of your program. So I know from the regional events that a lot of people are quite proud of their retention rates, but certainly within the statutory sector, we know that programs and interventions have a hard time keeping hold of people. So families might come along for 1 or 2 sessions, but then the kind of energy wears off. So whether there's any value in monitoring those that drop out, and I'll take this one and just say, I think there is value in doing that, and probably for two reasons. The first is around this idea of demand that Sarah's mentioned. So in trying to understand what it is about those families that need your intervention and also want it, an element of that is not just those who want it and are motivated to come along to the first session, but those who want it over the long term. What keeps people motivated? And whether that's something about the family's circumstances or particular risk within their environment, or whether that's something about the service itself that keeps on generating the demand, so keeps on engaging people. And I guess that links to the idea that Sarah mentioned, this concept of retention. So retention is about maintaining people's interest and engagement over the long term, and particularly where you've got an intervention that is 6 months or a year. Keeping people engaged can be very difficult. So finding out and going back and asking people the reason why they dropped out, whether that was due to an element of the service, perhaps I couldn't get there because you didn't provide transport, or whether it was something particular to that individual circumstances, like my working hours changed and suddenly it wasn't convenient. You get to know whether these are just individual factors that for that individual mean they can't attend, or whether there's something that you could attend to the service, you could change about the service that would be more likely to keep those people engaged. So I think there is value in monitoring people who drop out. And one of the points that we raised at the regional meeting was this idea that if you're doing user satisfaction surveys, not to just do those with people who come to the sessions, but to try where you can to send those out to individuals who've maybe come for 1 or 2 sessions and then dropped out, so that you're finding out whether it's an element of the service that would do with some adaptation. So I hope that's helpful in terms of that question. There haven't been any others come through, but one of the things that I think was raised at one of the regional events and might be quite useful to think about for others in general was, Sarah, when you talked about need, how you go about establishing that. And Nick, I don't know if you want to take this one, particularly where organisations have limited resources. How can they go about finding out what the need for their service is?
Thanks. I'll say a little bit more about this in a moment as well in my slot, but if you don't have the resources to do very much research yourself on need, I think there will be other useful resources. There will often be research that other people have conducted, whether a local university or maybe another local voluntary organisation sometimes might have done a community survey, or some focus groups with young people or something similar. So you want to try and pull that kind of information together. There might be some official data from the local authority about certain types of need, or maybe from schools about the types of difficulty that they're dealing with in schools. Having conversations with people, of course, and in whether they're managers of children's centres or managers in social services, getting a kind of a feel of the kinds of things where people are finding difficulties they're having to deal with on a regular basis, and perhaps where there's a gap in provision. That's important to think about what other services are out there, and are there some gaps that need filling. And then, of course, there is national data as well, which can be useful. So, for example, if you want to serve children who have a particular type or level of antisocial behaviour, there's a strong likelihood that there's some national data on that. And although you might be working in a discrete geographical area, you could use that national data as a proxy for local data. Okay, I'm going to talk now about the how and how to reach the right people. I want to start by talking about how to measure need and demand, two of the concepts that Sarah mentioned earlier. As you plan for intervention delivery, you need to work out how much need there is for the intervention, and this involves trying to establish how many people in a given area are likely to fit your target group. It isn't necessary to identify actual individuals, but you do need to arrive at a reasonable estimate of volume, and this requires doing some research or at least looking at existing research. One option, of course, is to conduct a representative survey of a community or city or other area in order to identify the proportion of people in the population who meet your target group criteria. For example, a survey in a local community might show that 15% of children aged 3 to 4 have high levels of conduct problems. Or you might do a study of agency case files. That might show, for example, that 30% of young people served by youth justice display antisocial behaviour and the particular risk factors that you're interested in. Even better, if you have additional information, you might be able to find out about where the people who fit your target group live, or which agencies serve the largest number of potential users. Throughout this, you want to focus on your target group criteria. In other words, let these determine what you measure. If you don't have the time or resources to do this kind of research, spend some time reanalyzing relevant research that someone else has already done. Ideally, this would be local, for example, statistical returns from the local authority or a survey by a local community organisation. But national data can also be useful, for example, a study that indicates the level of a particular problem or condition and its likely variation by geographical area. The next step then is to estimate how many of those who need the intervention will come. In other words, what is the likely demand? You could establish this through research, for example, by asking potential users if they would come to an intervention like the one you're offering. But it may be necessary to make some educated assumptions, informed perhaps by experience or soundings from colleagues, partner agencies, or potential users. You may conclude, for example, that only 1 in 3 of those who need the intervention are likely to use it. When you put these two bits of information together, in other words, need and demand, you have a very strong starting point for working out how to get the intervention to the right people. You know how many people out there you are interested in and how many are likely to be interested in you. You may even know where they are. And this is a good basis for finding them. But now, of course, you have to do it. And there's lots to think about. We can't go through every step here, particularly since what needs to happen will vary so much by intervention. But you need to think about two things. First, the route or routes into your intervention. And second, the people and organisations along the way you need to engage. Essentially, there are two routes into an intervention: self-referral or referral by someone else, typically another service or professional. A third route, which is particularly relevant in the case of universal school-based interventions, is being in the right place at the right time. Pupils are in many respects a captive audience. Whichever way, you need to think about every step along the route. For example, if children are to be referred, who does this and how? Or if you need to identify children with particular needs, who should collect what information on which children and using what method? Who do they share that information with? And how is that information used? We think it's useful to develop a flow chart that maps out each stage of the process. This might start as a sketch and then develop as you work out the details. You also need to identify the people and organisations on that route that you need to engage. You need to think about several things here. For example, will you meet them in person beforehand? What will you tell them about the intervention? What will they want to hear? What will put them off? How will you get them to do what you need them to do? We're going to talk a bit more now about the route and the people, starting with the route. So you've identified a child or family as potentially eligible for your intervention, and you need to move them a step along the route to the intervention. To do this, you need some more information about them. Normally, this will include basic personal information such as name, age, gender, ethnicity, and contact details. But you also need to find out if they definitely fit the target group. You need to know that they fulfill all criteria for being included in the intervention, and also that they don't tick any boxes that would exclude them. For example, a young person might display antisocial behaviour and have relevant risk factors. On face value, they fit the target group, but if their behaviour is especially severe, you might conclude that your intervention is unsuitable. So now you need to say what information has to be collected, and you need to say how it will be collected, by whom, and from whom. Sometimes the person you want on your intervention will provide the information, but sometimes it needs to come from someone else, a parent or carer perhaps, or a professional. And the information could be obtained in different ways, via an interview, from case notes, using a tried and tested screening measure, or some other means. There are many useful screening measures available covering different areas of children's lives, and they're worth taking a look at. Most are short and free to use, and they have instructions on how to score them and how to interpret the scores. When they're completed by service users, care is needed to keep the English simple, and you should provide help as needed. A clear process is needed for scoring the measures and feeding the results to the person or people who decide whether the child or family concerned is eligible for the intervention. That was about the route. Now we're going to think about the people and organisations along that route. Sarah said in the introduction that getting an intervention to the right people often involves a lot of stakeholders. And in order to get them playing ball, you need to build demand. You need to help them to want to do what you want them to do. To do this, you need to get inside their heads, to see the world how they do, and figure out how your intervention can be desirable in their worlds. You need to think like someone who works in marketing or public relations or sales and advertising. To help with this, it's worth doing some market research about your intervention. This doesn't need to be complicated or onerous. After you identify relevant people to talk to, develop a set of key questions for them. For example, what do they know about your intervention? Do they have any immediate thoughts about whether they would be interested? What do they think are the likely pros and cons of the intervention? Do they have any solutions to the potential cons? Can they tell you a little bit about the structure or context into which the intervention needs to fit? And are there any competing options? The aim is to get a sense of what the type of people who would be consumers of your intervention think about the intervention. This will generate useful insights about how to package and sell your intervention. To complete the market research we have just described, you could draw on what is already known about what service systems and the people in them want. So, as a rule, a commissioner is more likely to want to buy an intervention that would fit neatly into current arrangements. For example, it could be delivered by existing staff or fill a slot in the timetable currently occupied by something less promising. They will be more interested if it is clearly specified how the intervention helps with meeting statutory targets and inspection requirements. A professional considering referring a client will be more likely to do so if the target group criteria are clear and the client appears to fit. If they believe their client will benefit from and not be harmed by the intervention, if they know and trust someone involved in delivering the intervention, if they know they will be told what happens to the referral and the client, and if they know what happens after your intervention. Likewise, a practitioner will generally feel more enthusiastic about delivering an intervention that allows them freedom to be creative, respects and leaves room for their professional judgment, and involves lots of face time with children and families. Most practitioners also want to develop their skills and qualifications, to have opportunities for career development, to see evidence that what they're doing works, and also to further the cause of social justice. These are all things that would make someone more likely to want to buy, refer to, or deliver the intervention. Bear them in mind as you design and or introduce your intervention. But what about the people who would use your intervention? In other words, a child, parent, or family. People are more likely to come along if it fits their lifestyle and is easy and pleasant to do so. So think about the time of day you hold things. For example, can people who work attend? And make arrangements for a creche, refreshments, transport, translation, and so on. People will want to feel that the intervention isn't threatening, for example, that they won't have their children removed or find themselves being grilled or put on the spot. They won't want to feel that coming along stigmatises them in some way. They'll want to know that the intervention is going to help them, that it's relevant to their needs and likely to make their lives or the lives of their children better. People will also usually feel more comfortable about using an intervention if they've spoken with and even come to know someone who will be delivering the intervention. So it's worth spending some time beforehand building a relationship with that person. If appropriate, visit them at home, follow up with a phone call, and if they start coming, then call them in between sessions to check how they're finding things. To risk stating the obvious, people will also only come to an intervention if they've heard about it. Since they're unlikely to knock on your door, particularly if they have multiple problems, this means that someone involved in the intervention needs to go to them. They aren't going to be enticed by a few posters or on the notice board or a paragraph in your centre's newsletter. They probably won't even see them. You need to meet them on their turf, the shops, the GP surgery, the park, and so on. Lastly, getting people along once is a significant achievement and it gives you a foot in the door, but it in no way guarantees that they will keep attending. You need to keep providing practical and emotional support to enable them to stay involved. So just by way of conclusion then, I think it's easy to underestimate how much time and effort is needed to ensure that the right people receive your intervention. So make sure that you plan this element of the work carefully and allow enough time and money. Empty spaces are resources down the drain, so this isn't an area to scrimp on. Okay, and we now have time for more questions and discussion, so I'm going to hand back over to Ashley.
Great, thanks, Nick. Well, a couple of people have sent some questions in, but for the others out there who have got a burning question, then just pop it into your question box to me and I'll see if I can pose it to our presenters. A couple of things have come up around this idea of marketing, so I might put one straight back to you, Nick. Someone's asked whether you can give some examples of market research that's manageable. I don't know if you can think of some thoughts on that.
Sure. I'll give a couple of examples, although they're quite similar. They're both pieces of work that we've done ourselves. One was with the program called Life Skills Training, which is a program that goes into schools. It's for young people aged 11 to 14, and it teaches them about different life skills, like it gets them to think about their aspirations, their goals in life, whether their behaviour currently is in line with those aspirations. It's been proven to reduce or prevent misuse of alcohol, to reduce smoking, to reduce behaviour problems as well. And we were interested in introducing that in some secondary schools here in the UK. So we had a list of secondary schools that we were interested in targeting it to. We focused that on schools in particularly deprived areas. We had a long list of these schools, and we just started systematically phoning them and asking to speak to either a head teacher or the teacher with lead responsibility for ESHE. And we just had some very, very simple questions for them. So we started off by saying, this is what life skills training is, and getting their immediate reactions. And then we asked them things like what else they were doing in the curriculum that was similar to that particular program. We asked them what what appealed to them about the program from what we were able to tell them. We asked them what might be some of their reservations, and yeah, I think those were the main questions, and it was a very useful exercise because it gave us a good sense of things that should be said and not said when marketing the product. So, for example, people said, stress that this is a life skills program. Don't major on the alcohol and drugs part of it because that's going to put people off. We got some useful information about where in the curriculum it would fit and how many sessions would be available for that and on which teachers would be most likely to provide the intervention. We got some sense of the extent to which it would need to replace things that are already there, or whether there were slots in the curriculum that could be filled up. So it was very useful, and it helped us as we thought about how to get other schools on board. And we did a similar exercise with an anti-bullying program that comes from Finland. It's called Kiva, and similar thing. We contacted schools. I think in both cases we only spoke to about people from about 10 schools, which was quite difficult because just because people often weren't available. We also spoke to people at a higher level or a broader level in education, so maybe local authority education staff, education psychologists and so on, and got their perspective. And the questions were similar, and it was just very useful in terms of thinking about likely demand for those interventions.
Great, thanks, Nick. Two questions that have come in, and then I'm going to try and kind of merge them together. The one is asking for some examples of how you actually market social programs, but the other, someone wants us just to kind of repeat some of the points you made, Nick, about how you make a person want to buy into an intervention. And so I think on that we might just think about those different groups that we've highlighted again, those commissioners of services, the practitioners that might be delivering the service, and then the family of children that you want to recruit, and how you might market those programs differently for those different audiences. So some of the things that Nick's mentioned in the slideshow, and he can probably add some others now, but are for commissioners to think about how it fits with the current arrangements that may be in place within a local authority, particularly within schools. If a school's commissioning or purchasing a particular intervention, how is that going to map on to their curriculum and their requirements around Ofsted and inspection? For practitioners, I guess the marketing of an intervention, selling an intervention to them, or engaging with them that the intervention's a good idea, are around these ideas that Nick's mentioned of allowing them to be creative, allowing them to use their professional judgment, linking it in some way with training and accreditation, emphasizing that programs allow for time with children and families. It's not a paperwork exercise, I think will be incredibly enticing. And then I guess latterly the group that Nick mentioned were the children and families themselves, so ensuring that it fits with their lifestyle, that it's nice to come along to, and it's not threatening to them, that it's going to help with the problem. But one of the things that we've learned, I think, along the way is that, particularly as researchers, is that although evidence is important, it's often the stories that sell an intervention. So if you, and for many of you this is the case, you've already got families or children and young people that you've been working with who are your kind of success stories. But those stories and the ability to allow others to hear how they've benefited from your intervention, those are the things that often market an intervention. So Nick had a slide up earlier with lots of different kinds of materials that that might be used for an intervention that might publicize, thanks Sarah, might publicize an intervention. Some of these are kind of materials that would be used in class, Twiggle the turtle, but others are things that you might use to promote the intervention, and they're all colorful packs and very enticing. And you might think about how you can do some of those things, but they needn't be very resource intensive. You don't have to spend a lot of money. I think the idea is to think about, are there case studies, are there stories that sell your intervention, and how do you market that differently for the different audiences? What is it that your different audiences need and want? So I hope that's been a helpful repetition of some of the kind of main points that Nick was pulling out, and a response to that question around marketing. Another question that's come in, Nick, it might come back to you, or Sarah, you could add on this, is people are interested in screening and how you do that, but particularly if there are places they can find some more information on screening measures.
Sure, yes. There are several sort of compendiums of these kind of measures. As I say, a lot of them are free, and some are online as well. Some of them you have to get from books. But what we'll do after the session is draw up a list of places to look for these kind of things, and you'll be able to. We'll put that on the information hub and send you the link to that, and you'll be able to look at those. And of course, some of the measures that are included in the outcomes framework would serve or could serve as screening measures as well. So let's say, for example, you're interested in serving children with a certain level of behaviour problems. Well, something like the strengths and difficulties questionnaire would be a good measure to use for that, and that's one of the measures that's being used in the outcomes framework. I just want to add, sorry, very briefly to the previous question about, and a couple of examples. One thing we've done when we've introduced school-based programs is to have a head teachers forum, and even before head teachers have signed up to necessarily signed up to implement the intervention, to get a small group of head teachers together and talk the whole idea through with them, that's been very helpful. Something else we did was have a kind of quite a sort of day-long event with a nice lunch and everything, where we had the developer of a program come and talk about it. We had teachers who had used the intervention in other schools came and talked about it and gave some case studies like Vashti mentioned. We also did a dummy lesson at one of these events. So some children from a local primary school were all kind of bussed in, and they all sat around and they did one of these lessons, and it was like a little roadshow. People could there were lots of rooms, different things happening in different rooms. People could go into this room and see a lesson being taught. They could go into another room and have a good look at the materials, leaf through them, and so on. And that leads me on to my last point, which is we found it very helpful to show the materials to people. That can be a real selling point, but also to say there is some scope for adaptation, particularly if it's an evidence-based program. And certainly we've in places where we've introduced school-based programs, we've usually hired a teacher from the local area to go through the materials and to suggest adaptations. And again, that sense that you're not just imposing something on someone, but you're giving them a chance to shape what gets implemented is quite a powerful selling point, I think.
Great. There's been another question that probably relates to some of the content from your section, Sarah, around how regards referrals and target group. How would you manage negotiations with referrers who are kind of desperate for their client to have your service, but under your target group criteria, that young person is not eligible? You've got some thoughts on that?
Sure, and I know this is an issue for some of you guys who are watching the webinar now. It's come up in diagnostic meetings and things. So I think there are a couple of things to say about that. The first thing is to make sure that you have some really clear and simple messaging about your target group to start with. So when you're providing information to potential referrers and providing them with forms to fill in, keep it simple and keep the information clear. And it can help to provide pen portraits or case studies of the kids or the families that are eligible for the intervention in the first place. And to make sure that when kids come through that aren't eligible, or families, that you feed back to referrers why that is the case. So that's the first step. Failing that, if you're still getting referrals through for kids because referrers are desperate for services for the children they're serving, you'll need to think about developing some strong messaging around your intervention and why it's suitable for a particular group of kids. So you'll need to try to think about how you explain that your intervention is based on a sound logic model that in many cases for you guys is underpinned by some research evidence about what's effective for particular kids, and that actually your intervention might not be the best response. They might get a service, but that's not what they need for their particular problems. And try to hold on to these principles that we talked about earlier, that the more people you let on, the more kids you let on that don't actually meet your target group criteria, the less spaces you have for the kids who really need the service. And actually, by letting those kids on, you're giving them a service that isn't designed for them and may not actually have any positive effects and could actually potentially do some harm. So I think it's about providing some kind of clear, structured information and developing some strong messaging in the communications you have with referrers about what your intervention is, that the target group is really closely linked to your theory of change, why it is what you do has an effect. I don't know if anybody else wants to add to that. Any more questions, Ashley? No, I think that's it there for the questions. So all that's left to say is thanks very much for joining us. I hope that you found the webinar useful and it's given you some ideas about your own kind of replication plans for realising ambition. There will be a little bit of follow-up, so as we did last time, we'll send round the link so that if you want to watch the webinar again or pass it on to colleagues, then you'll be able to do that on our website and probably from the information hub as well. There'll be a frequently asked questions document that will just cover some of the questions we've already addressed, and if any others have come in or come in afterwards, then we'll try to get to those in the FAQ as well. Yeah, so I think that's everything to say. Thanks again for joining us, and we're looking forward to seeing everybody again soon. Okay, thanks a lot.